Next, we have joint mobilization techniques. So first we're going to start with the talus curl joint, and we're going to do distraction. So you're going to interlace your fingers over the dorsal part of the foot. You're feeling with your pinky fingers, so you can assess the grades. Having your elbows together, you can do different oscillations here. Then you can also do a grade 5. I just cracked her a second ago, so we didn't get a pop effect for this one. And then we have a posterior glide. So you can hold the underside of the tibia and the fibula, get them in open packed, and then you're using your web space of your hand on the talus to do that posterior glide, facilitating increased dorsiflexion, and you can do different grades here as well. And I can have my patient flip prone to do an anterior glide. We're going to use the calcaneus, and then we're going to stabilize the tibia and the fibula to the table. And we're using that calcaneus to facilitate a anterior glide for the talus curl joint to increase plantar flexion. So next we have the subtalar joint. So I have my patient in side lying, and I'm going to get their top leg on top of me. I'll show you. We're just going to do it from the same side lying position, although obviously we would do the same ankle and have it flip. So we're going to start with distraction. So for distraction, you do a whipping motion. So you're having the calcaneus and the cuboid joint. So you're using your thumbs to distract the calcaneus and then put them into a little bit of inversion. And let me do this for some reason. A little bit of inversion, and then you go up and flip like that. And then we'll have them flip to the other leg. And then we have the same type of thing, but backwards. So to get the medial side for distraction, you have the calcaneus and the navicular. Same type of thing. Your thumbs are pushing out to get that distraction force, and then into eversion, and then getting that whip as well. Next, we have our patient in sideline, but in the opposite direction. So we're going to do medial and lateral glides of the subtalar joint. So we're going to start with our medial glide. So we have the medial part of the patient's foot on the table, and then you're going to support the foot with your leg, and then use the palm of your hand on their tibia and their fibula, and then you're going to be using the palm of your other hand to provide that medial force into the ground, basically, so their heel's off the table. So this is going to be facilitating eversion. And then we can switch legs. Obviously, the patient wouldn't have bilateral leg problems with opposite motions, but get the idea. Same thing, you're going to stabilize with your leg and then push laterally. So that's facilitating inversion. Moving on farther down the foot, we have the intertarsal joints. So we're going to slide off of the first metatarsal onto the medial cuneiform, get a grip dorsally and planarly. I think I just made up a word there. And then farther down, find the navicular. And then you're going to do dorsal and plantar glides of both of those to assess and allow for some more movement there. So those dorsal glides are going to be facilitating supination, and the plantar glides are facilitating pronation. And then you can move farther down and assess. You can also assess in between cuneiforms too. So taking the medial cuneiform, moving to the intermediate cuneiform, and assessing and treating those for additional mobility. And then doing tarsal metatarsal. So going back to the medial cuneiform, you can take the metatarsal and move dorsally, stabilizing the medial cuneiform, and planarly back and forth. And then we can also do intermetatarsal, same thing, dorsal and plantar glides there. This can also be a pain provocation test, which we saw last week, so watch out for pain here. Make sure you're watching your patient, see if they're doing okay. And then for phalangeal and metatarsal, so you can do distraction, stabilizing the metatarsal. Doing distraction, you can do twisting. And in addition to that, you can also do dorsal glides to facilitate extension and plantar glides to facilitate toe flexion. You can also move farther down and do the interphalangeal joints as well. Same thing, distraction, dorsal, and plantar glides there. So next we have some mobilization with movement techniques specific to certain losses of range of motion. So first we have plantar flexion loss. So we have them in slight hook line, and then I'm trying to not block myself with the camera. So you're providing a posterior force on the tibia and the fibula, and then the patient is going to actively plantar flex, and then you're going to do an overpressure force in addition to that. So that's assisting plantar flexion. And then for the next one, we're doing a dorsiflexion loss. We're treating a dorsiflexion loss. So we're going to be doing a posterior glide of the talus, and then we're going to have our other hand on the patient's calcaneus doing an anterior glide of that calcaneus, and then you can use your forearm to do overpressure. So we're going to start with that posterior glide of the talus, and then have the patient actively dorsiflex, follow them through that range of motion, and then use your hand, your forearm, to provide that overpressure. And then next, we have an inversion loss. So we're going to stabilize the tibia with one hand, and then get your leg on the outside of the patient's foot. And then you're going to be doing a superior to posterior, or superior and posterior directed force on the fibula. So as you do that mobilization, the patient's going to invert, and then you can use your leg to do overpressure there. So for thorax today, we're going to focus on common stretches and strengthening exercises for dancers. So for dancers, flexor hallucis longus tendinitis is really common. So we're going to start with a stretch. So to stretch the flexor hallucis longus, we're going to have our patient use a little towel like this, rolled up nice and tight. And we're going to put that under their big toe. And then all they're going to do is get their foot on the floor, and then bend their knee, and then hold that stretch for 15 to 30 seconds. I'll fast forward so that we're not here all day. So next we're going to do some strengthening exercises for the flexor hallucis longus. So we're going to do a bit of a progression. We're going to start off with that towel that we used before for the stretch, but instead of stretching, we're going to do some strengthening. So we're going to start with basically, I'm going to mimic, so she's exactly doing it right. So you're going to use your toes to scrunch up that towel and then release. It's basically just the towel is almost a tactile cue to do like active range of motion. So you can just hold it and then let it go. So the next step up from this would be to maintain that contraction and actually hold something with it. So I have a little bit of a box here from a puzzle that we were doing during quarantine. And then I have batteries here. You can also do this with marbles or any small object. The thing with the batteries is because they're long, she could try to compensate by using her other toes. So ideally, we want her to just be picking it up with that big toe. So she's going to try to pick up the battery and then put it in the box. So that way she has to maintain that contraction and then place it elsewhere. So then the next step up from that would be to use a TheraBand. So you can take the TheraBand and put it around her big toe, and then bring her into extension, and then have her flex towards the floor. In order to increase this range of motion, you could also prop her foot up so that way she can go further into toe flexion with this as well. And then she can do a series of contractions of these. You can also change it by having her slow on the way back up, slow on the way down, hold it, to get that strengthening with that eccentric contraction as well. So next, we're going to do some standing balance activities. We're going to take these and make them functional for your average dancer, since we've been on a dance topic today. So we're going to use some functional movements that most ballet dancers are doing in their rehearsals or warm-ups or in their actual shows. So we're going to start with an arabesque, and we're going to use the chair as needed to help us with the standing balance, but we're going to be focusing on single leg stance for the purposes of today. So we're going to do an arabesque. Lost my voice there for a second. So you're going to be extending your left leg and then bringing that body forward, and then you can bring this arm up to help you balance exactly, and then use the chair as needed exactly. So you're getting, by getting these motions throughout the rest of the body, you're challenging through basically an internal perturbation, and then back. Beautiful. So the next one we're going to do is attitude devant. So the way that's going to look is you're going to bring your leg out in front of you. Try to point your toes. There you go. And then you can bring it out to the side and then around back. And then you can challenge them to bring them back around to the front as well. So doing that transition through those moments, creating an internal perturbation to challenge that dynamic stability of the foot, as you can see. Do it one more time. You can see those ankle strategies really going to work as she does it.